Endometrial cancer, or cancer of the uterus, is the most common cancer of the reproductive organs. In fact, it is the fourth most common cancer in people with a uterus. To put this in perspective, an estimated 8,000 Canadians will be diagnosed with endometrial cancer this year. People carry extra weight for a variety of reasons, many of which are not by choice. Living with obesity can be a risk factor for cancer and for other conditions such as diabetes and heart disease. In fact, endometrial cancer has the strongest link to obesity of all other cancers. We know that adipose tissues, or cells that contain fat, actually secrete estrogen. And when the uterus continues to be exposed to estrogen, it can increase the risk of cancer. There is still a lot we have to learn about the other ways obesity increases your risk of endometrial cancer and why it happens to some women and not to others. Endometrial cancer is often diagnosed early, when surgery can provide a cure. If possible, we try to do this surgery through small incisions or through what is called a minimally invasive approach. For people who carry extra weight, there are some challenges to complete this surgery. Weight loss prior to surgery increases the chances of completing the surgery with a minimally invasive approach. In turn, this results in fewer complications and a quicker recovery. Specific weight loss programs exist to support people who are preparing for this surgery and throughout their weight loss journey.
It is widely but incorrectly believed that obesity is the result of a lack of willpower, lack of motivation, or character flaw. This is simply not true. Body weight is actually most affected by genetics. In fact, 70% of a person's body weight is determined by their genes. Most of these genes are expressed in primitive or subconscious parts of the brain that control things like appetite and metabolism. This is why obesity is a chronic condition. It's not something that can go away by making changes to nutrition and physical activity. Obesity is a medical condition that requires medical treatment. Many people have lived experiences that show you can influence your body weight somewhat by making changes to nutrition and physical activity. However, these typical weight loss interventions unfortunately lead to powerful biological responses that, in all cases, lead to a weight loss plateau and also promote weight regain. For example, when you do everything right and lose weight, all of the hormones that make you feel hungry increase, and all of the hormones that make you feel full decrease. As many people experience, you will feel more hungry when you lose weight. When a person loses weight, there are also changes in the parts of the brain that control the desire for food and control how enjoyable food is. So in fact, when someone loses weight, cravings increase. They desire food more strongly and they enjoy food more. Food actually tastes better after you lose weight. We also know that when someone loses weight, their metabolic rate decreases. This means that they burn fewer calories at rest and with exercise. Because changes to nutrition and activity alone lead to these powerful biological responses that make the management of obesity difficult, changes to nutrition and activity on their own are not a very effective treatment for obesity for many people. Moving forward in your weight management journey, keep in mind that obesity is a real medical condition. It is largely determined by genetics, it is centered in primitive parts of the brain, and the body and the brain defend against weight loss.